Patients with disabilities face some unique barriers to care in dentistry. Here's what you need to know. Did you know that 36% of people in Tennessee know someone with an intellectual or developmental disability? There are different categories of disabilities. There's physical disabilities, intellectual and developmental disabilities, as well as sensory disabilities. For physical disabilities, some examples of this are those with a brain injury, with a spinal cord injury, cerebral palsy, or muscular dystrophy. For intellectual and developmental disabilities, this may be patients who have Down syndrome or autism. And sensory disabilities often fall within the other categories or comorbid with the other categories. It's not uncommon to find a patient that has all three categories as well. So, for physical disabilities, some barriers to care are going to be if they're in a wheelchair, finding an office that is wheelchair accessible, getting to the operatory because all the equipment is tight, transferring from the wheelchair to the dental chair. And if they cannot do it themselves or their caregiver cannot do that, then the dental team needs to do that, and not every dental team is able to do that. If they're in a walker, again, they have to navigate through the office, and depending on how the office is set up and tight, that can be a barrier, a physical barrier to care. Another barrier to care for home care for them is if they don't have the physical dexterity to hold a toothbrush. So then they may not be able to get their own teeth brushed. They may have spasticity, which means the muscles are tight, and they may not be able to open wide enough for a caregiver to be able to brush their teeth. Even if they are able to cooperate in the chair, their mouth still may not be able to open wide enough for them to physically be able to have treatment into the chair. For intellectual and developmental disabilities, you may have issues with sensory issues are very common with this, as well as communication issues. Often patients with autism are nonverbal, so therefore they cannot communicate what is bothering them if they have pain. So you must rely on physical cues and the caregiver for this. So are they touching their face? Are they chewing more on another side than they used to? Are they wincing and kind of tilting away as they're trying to brush their teeth? These are some physical cues that something may be going on with them. The patient may also use an AAC device, which is an augmented alternative communication device. It's usually a tablet where they have keys on it that help them put sentences together so that you can understand what it is they're trying to communicate to you or to their caregiver. These patients may also not understand what is happening to them, where they're at, what is going on, and they're scared and they want to leave. They may run, they may scream. Offices aren't always accepting of that. Other patients aren't always accepting of that. And that can be a barrier for care as well. Patients with sensory disabilities can face their own unique challenges as well. They can have reactions to bright lights, loud sounds, too much going on in the waiting room, too many people moving around. Some things that can be done in an office to try to make these more accommodating to them are having noise canceling headphones available, to have alternative waiting rooms or even waiting in their car before they come in. You can also add in low lights because the overhead lights are bright, or provide sunglasses to help minimize the bright lights. Weighted lap pads and weighted blankets are also very good for them because it applies a constant deep pressure to them, not a painful pressure, just a pressure that helps them to feel where their body is in the space. It gives them a sense of calm. For these sensory issues, these sensations to them aren't just annoying or they can't tolerate them, they're actually physically painful to them. So, anything an office can do to help to minimize that pain for the patient will help to make them more comfortable in the office and more likely to have successful visits in the office. Not every office has this, but these are pretty easy things that can be added into most offices. Often, patients with physical and intellectual developmental disabilities may not be able to tolerate treatment in the chair at all, and an alternative is sedation dentistry may be what they need. Not every office has this either, and there are different types of sedation in office and general sedation. So, in office may be enough, nitrous or the laughing gas, or it may need to be a little deeper, IV sedation, but not everyone is a candidate for that. General sedation in the hospital setting may be what they need. And again, not every office has the ability to do that. So every barrier that you put in limits the offices that are available to these patients. It may cause them to have to drive for hours to find an office that can see them. So adding simple things in, like transfer boards to help the patient transfer, clearing things away so that the patients can get through, good communication with the caregivers, having a pre questionnaire to be able to ask the patient's caregivers about them ahead of time so that you can get these things in order for them to make their visit much more comfortable or ideal. If you have the ability to add in sedation, add that in, or have a list of other providers that you may be able to refer them to. Not every office is going to have the ability to add all of these things in, but just adding a few can increase access to care, will allow more patients to be seen in a timely manner that have physical and intellectual and developmental disabilities.